of the biggest project of JPF. So iBRETA is a platform for research community and medical community to encourage the communication and collaboration based research for complex questions. It also focuses on creating awareness about different aspects of health and diseases, and also to develop a scientific mindset in youngsters. So it has 4 pillars: research, education, training, and awareness. So in research, the main aim is to develop an investigative attitude among young biological researchers to address complex biological questions. Next is education. So unfortunately in India, the education curriculum is so much restricted to the concept memorization, and there is a loss, there is a very lack of problem solving exercises. So main aim of this particular education pillar is to develop the scientific understanding of students toward approaching the biological questions rationally and logically. Next is the training section, and where we see there's a lack of knowledge about basic healthcare practices and hygiene. So main aim of this pillar is to provide expert guidance and training to the public for the health issues and at family and community level. The last and 4th pillar is awareness. So I know today's world is very internet powered world. With the single click, we can get hell lot of information. But there is a still gap between scientific society and the layman community. So there are various terms or facts which are misinterpreted by the non-expert community. So the main aim of awareness is to deliver curated, authentic, and scientific information to the public about the various aspects of health and diseases. So up till now, we have covered this many sessions under awareness section, and we have covered unique topics, and we invited the expertise in respective fields. So in our previous series, like there were 3 sessions up till now, and those are monthly hormonal circus, where Dr. Girija Wag discussed about basic anatomy and physiology of menstruation, and also the main hormones involved in the menstrual cycles. The second session was menstrual well-being, diet, and hygiene, where the modulation of diet and hygiene were discussed so that we get healthy and easy periods. And the third session was about menstrual disorders, where we discussed about the common menstrual disorders like PCOS, PMS, cervical cancer, breast cancer, etc. So you can find these sessions on our YouTube channel. And today's session 4 is the We Friends, that is, we are going to discuss about menstrual products. Also, we are going to burst up certain myths about this menstruation. So without any delay, let's start the session. I request Dr. Biniwale ma'am, before starting the session, I would like to introduce Vaishali ma'am. So she is an amazing gynecologist, and she has done tremendous work in this area. She has published a book on maternal health. Also, she has published articles on women health in various newspapers, and she is consistently working on the issues focusing on rural empowerment and through the Gnan Prabodhini Grama Vikas Vibhag. So I request Vaishali ma'am to start with the session. Also, I request Devashri to take over the interactive session. Over to you, Devashri. Thank you. I stopped my screen, so we can continue.
Thank you, Shrutitai. Hello, ma'am.
Hello, Devashri.
Without further ado, we should start with our session. So, from our previous sessions, we got to know a lot about menstrual health and what should we do, what should we not do, what kind of care we should take, etc. Through all these sessions, we came to know that there are nowadays lots of multiple options of menstrual products, hygiene products available in the market. And it's a good thing that there are so many options available, but along with it, it kind of creates a confusion also. So if you could start by guiding us regarding this, that would be great.
Okay. Thank you, Devashri. Thank you, Shruti. Thank you, JPF Foundation. Basically, we'll be talking about menstrual products initially, and then we will discuss other things. When we are talking about various menstrual hygiene products, I would like to divide them into two parts. One is menstrual, the things which are used during menstruation. That can be something like sanitary napkin or tampons or menstrual cups. And the second thing that the second part will be about hygiene products which are commonly used or advertised, that they are necessary for hygiene. So like something like vaginal washes, douches, and all these things. So when we are talking about menstrual hygiene products, the commonest thing that is used is sanitary napkin. Now it's been in use for years together. Previously, it used to be a cotton one which was made at home, and now commonly used is the disposable one. Advantage of sanitary napkin is very easy to use because you don't have to learn any technique of using it. It is very easy to use. What it does is basically it will absorb the blood which comes out to the vaginal opening. And therefore very easy to use, not much side effects, not much problem, except it can give rise to little amount of reaction. The problem with sanitary napkin is there are two types of sanitary napkins. One is disposable sanitary napkins, which are commonly used. We know the brand names, where there are so many brand names like Whisper and Stay Free and Carefree, and all the time it is advertised on televisions and radios and everywhere. So these are the sanitary napkins which are disposable sanitary napkins, and so it is one-use sanitary napkin. Now the problem with these napkins is it can sometimes give rise to rash because it has got a synthetic covering to allow maximum absorption and to prevent any spillage. And second most important thing is we should also think about whether it is eco-friendly or no. So the problem is it is absolutely not eco-friendly. It is made of non-biodegradable material. Now, if we see the problem of this sanitary napkin, so it is said that around 12 billion sanitary napkins every year are disposed in India, and they go into landfill. So 12 billion sanitary napkins go into landfill, or if we check about how much waste it actually creates, so 3 lakh tons of sanitary waste is created by the sanitary napkins, and these are basically non-biodegradable. So how much time usually they take for degradation? It can be any time between 250 to 800 years, or sometimes it is absolutely non-biodegradable. So this is a major issue which we are actually facing now, as well as we are going to face in future. And so therefore there are various options which are thought about, and that leads to another like non-disposable or reusable sanitary napkin. Now usually reusable sanitary napkin is made of cloth, and therefore every time after use it can be washed and reused. Now, the problem with reusable sanitary napkin is it is very difficult to use when you go out of station. So if you're going on a trip or something, it is not possible for you to wash it there and then put it for drying and all these things. But whenever possible, why not try it? We have to be very sure about cleanliness and hygiene of this product. So we have to wash it properly after use. So need to wash it in clean water. Initially, I usually say that first wash it with cold water, and allow all the blood and the stains to go. And then you can wash it in warm water or hot water. You can boil it after every use and then put it for drying. When it is completely dry, then you can store it in a clean bag or something, so that there won't be any possibility of infection. So when we are using reusable sanitary napkins, we have to take care of cleanliness or hygiene, so that it will not cause infections. Now, one very important thing about sanitary napkins is many times women don't know that you have to change sanitary napkin every 6 to 8 hours. So whether it is full, whether it is completely soiled, whether it is half soiled, but still you have to change it, because that menstrual blood is a good medium for organisms to grow or bacteria to grow, and therefore there is a possibility of infection. So you have to change it every 6 to 8 hours. Maximum you can keep it for 8 hours. Now this is regarding sanitary napkins. The second option can be tampons. Tampons are inserted in the vagina, and tampons will again absorb blood, And once it is full, it can be pulled out with the help of a thread which is attached to the tampon. Again, it is not reusable. Again, it is disposable. So it is also going to create plenty of wastage. But advantageous thing with tampon, or even I would say sanitary cup, is many times when you use sanitary napkin, there is a specific smell which is associated with that menstrual blood, which you can smell when you are menstruating. So that usually is because of the blood interacting with air. So many times when you use things like tampons, or if you use sanitary cups or menstrual cups, you won't get that smell. So many women actually like it because they are less messy. The third option is sanitary cup, which is in use just for last 4 or 5 years, I would say. This sanitary cup is made up of silicone material, which is considered as an inert material, so that it will not give rise to irritation or any reaction. Now, sanitary cup, it is basically a cup-shaped thing which is inserted in the vagina, and it will collect the blood. Now, how it is inserted? Basically, you have to fold it. There are various types of folds. Now, this all information is usually available with that literature which is provided with menstrual cup. And you have to fold it so that the size of the menstrual cup reduces, and then you put it in the vagina and then remove the fold or open it. So it pops up, and when it pops up, it will actually provide a vacuum which will not allow spillage of blood. So it will prevent spillage of blood. Now, before removing it, when it is full, before removing it, you have to again press at the base of the sanitary cup and then pull it. Once you press the base, the vacuum which is there is it's lost, and then you can pull it very easily. Now, many times the question asked to me is for us to if say I don't have children, or if I'm not married, whether it is possible. There are various sizes which are available, like small size, medium size, big size, large size. So small size, many times it is possible. Another question asked to me is whether using tampon or using sanitary cup, will I lose my virginity? So what do you mean by actual virginity? Virginity is, it's loss of virginity is basically first sexual interaction or sexual intercourse or sex, I would say. Just breakage of hymen does not mean loss of virginity. Now, hymen many times break during various exercises like swimming, cycling. So there is no specific definition or definite sign of loss of virginity. So putting in a sanitary cup, menstrual cup, or putting in the tampon you will not lose your virginity. Maximum thing that will happen is maybe your hymen will stretch or it may break. Doesn't matter, because it is that sanitary cup or menstrual cup, if you use and if you are comfortable, there's nothing like it. Now, again, problem with sanitary cup is you have to change it every 6 to 8 hours. Maximum time you can keep it is for 8 hours. After 8 hours, you should take it out. You have to clean it throughout the blood. Then you have to clean it with water. And then after cleaning, you can reinsert it. At the end of menstruation, always clean the menstrual cup. There are many times solutions or powders which are provided with menstrual cups. So you can wash it with them, or you can wash it with warm water or hot water. You can even boil it and then put it in the sterile container, which will help you to keep it clean and keep it hygienic. Now, sanitary napkins, sanitary napkins, you can use it for more than 6 to 8 hours. Sanitary or menstrual cups, you can use it for 6 to 8 hours. But usually what we say is tampons should not be used for more than 6 to 8 hours, because it is associated with a problem called as toxic shock syndrome. And this toxic shock syndrome can occur if there is, if the tampon stays inside the vagina, there is bacteria, this toxic shock syndrome with that tampon, and this can give rise to a very lethal or life-threatening problem of infection, that is toxic shock syndrome. So whichever sanitary product you are using, make it a point to change it often, and always have hygienic practice sanitary products. Now, other set of necessary at all. So only if your doctor suggests you for some reason, then you can use it. Otherwise, just keeping that area clean with warm plain water is what is sufficient. So during menstruation, keeping that area clean, every time you change the sanitary napkin or change any menstrual cup or anything, just clean that area, make it dry, and then change the sanitary napkin, or that much hygiene is enough. No need to use any chemical based materials. It is absolutely not necessary. Any question about it?
Thank you, ma'am. It's pretty much clear. And apart from the products, there are so many doubts, or let's say fears also, regarding diet during PMS. So as we have come across in past sessions, that PMS is a very important integral part of menstrual health and menstrual cycle. So I mean, I personally have heard a lot about you should not eat this kind of fruit, that kind of thing. What would you like to tell us about it?
I think last time we discussed about PMS in detail, but just to brush up. Premenstrual syndrome, these are this set of symptoms or signs which are experienced by a girl or a woman before her period. So it usually occurs in second half of the cycle, that is just before menstruation. Now, it usually occurs because of hormonal fluctuations, or maybe some neurotransmitter fluctuations, and your body is too sensitive to those hormonal changes, and because of which you feel more of PMS symptoms. Now, PMS symptoms are of two types. One is physical symptoms like bloating, weight gain, breast tenderness, or sometimes acne, migraine. And there are emotional symptoms like depression, anxiety, panic attacks, irritability, mood swings. Mood swings is very common. So these are the emotional changes which we commonly see in a premenstrual period. So these are emotional problems with premenstrual syndrome. Now, if they exaggerate, it leads to something called as premenstrual dysphoria disorder. That is, it's a psychological disorder where you need a medical treatment. But mild to moderate symptoms of PMS usually are taken care of by our changing little bit of lifestyle. So in that lifestyle, diet is very important. So what helps? So basically, take plenty of fluids. Take anti-inflammatory foods like fruits and nuts. They are anti-inflammatory foods, so they actually help. It is better to avoid spicy food. It is better to avoid salty food, because salty food will give rise to more water retention. So to avoid that. Even caffeine, it is better to avoid caffeine. Stop smoking in that period. Reduce alcohol during that period. That usually helps reduce the PMS problems. Now, one more thing I would like to say is many times you tend to get more period pain, not only about PMS, but about period pain also. So you tend to get more period pain when you are constipated. So the things which will cause constipation should be avoided in a premenstrual and menstrual period, because that will exaggerate the pain. So having simple home cooked food, fresh food, is something that we recommend indefinitely, ideally throughout the cycle, but definitely in a premenstrual and menstrual period.
Thank you, ma'am. I think diet and medication go hand in hand. So along with medication, vaccinations exist regarding conditions like HPV. So
yeah,
you could guide us, because HPV is a very important topic currently right now, and personally, including me, lots of people don't know much about that area. What is HPV vaccine, how it is used, when it should be administered, etc. If you could tell us a little bit more about it in detail.
Right. Now, HPV is human papilloma virus, and there's a vaccine which is against this HPV virus, that is human papilloma virus, and that is HPV vaccine. So I think you are aware of the fact that cervical cancer, cervix is opening of the uterus. So cervical cancer is commonest genital tract cancer in women. And unfortunately, it is very common in India. So 1/4 patients of CA cervix are found in India. If you ask me what is the number of patients, so every year we say that 1 lakh cervical cancer cases are annually diagnosed in India, and more than 60,000 women die because of CA cervix every year. So if you ask me, around 180 to 185 women die every day because of cervical cancer. But most importantly, it is important to know that cervical cancer is a completely preventable cancer. Now, why cervical cancer occurs? So 99% cases it occurs because of human papilloma virus. There are more than 100 strains of human papilloma virus, but few are more malignant than or carcinogenic than others. Now, to prevent this cervical cancer, because it is a completely preventable cancer, we can prevent it in two ways. One can be primary prevention by giving HPV vaccine, and second will be by doing some tests, that is secondary prevention. Now, primary prevention is by giving HPV vaccines. Now, we have two types of vaccines which are available, especially in India. There one is quadrivalent vaccine, which has got 4 strains of this HPV virus. They are 16, 18, those are most malignant strains. And then is 6 and 11. They are responsible for warts or viral HPV warts. Now, these 4 strains are taken care of in HPV vaccine. There is one more nanovalent vaccine which has now come up, which contains 9 strains, but it is a little expensive for Indian population, so not very commonly used. Now, Serum Institute has come up with, again, a quadrivalent vaccine, which is now available, which is getting available, I would say. And that is definitely going to reduce the cost of cervical cancer vaccine, because till now it is little on a higher side. Now, when it is recommended to all women between age of 9 to 45. There are 3 doses which are required. First dose, if taken today, then second dose should be after 2 months, and third dose should be 4 months after the second dose or 6 months after the first dose. So 3 doses are required. Now, when it is ideal to give vaccine, if we give vaccine before age of 15, that is most ideal. Or at least till before the girl is sexually active, if we can give vaccine, that is more useful. Why? Because HPV, maximally it is transmitted by sexual route. So it is a sexually transmitted disease. It is also known to be caused by contamination, but sexual transmission is the commonest transmission. So before girl is sexually active, if we give HPV vaccine, that will be better. So this is primary prevention. The vaccination is in national vaccination program in various countries, but it is still not in India. In India, it is not still in the national vaccination program. Now, it is also recommended to boys in various European countries, even in Canada, and it is because it also prevents anal cancer and penile cancer, but it is not yet available for boys in India. Now, this is regarding HPV vaccination. Secondary prevention will be by doing various tests which will diagnose cancer in a pre-cancer stage. So commonest test which is used is called as pap smear, which has been in use for years together. Now, what we do in pap smear is we collect fluid from cervix. It is simple test, painless test, and very easy test. And then we send it for cytological examination to check whether there are any pre-cancer cells in that smear. So if there are any such cells, then we can treat these patients beforehand to prevent cancer later. Similarly, we can also do HPV testing. So we actually check whether there is HPV virus present in cervical fluid. Because if HPV virus is present, then these girls, all these women are more prone, they are high risk for cervical cancer. Then they need more supervision to prevent or to check if cancer is occurring earlier. There are various other tests also, like VI, colposcopy, so many tests. But it is important that all women between the age of 25 to 65 who are sexually active should go for pap smear testing, whether they are sexually active now or they were sexually active beforehand, but they should go for pap smear or HPV testing every 3 to 5 years. Now, pap smear is repeated every 3 years. Now, if you are in US, it is repeated every year. If you are in UK, it is repeated every 3 years. So India, we usually repeat it every 3 years. And HPV testing should be repeated every 5 years. So this is definitely useful because it can secondarily prevent cervical cancer. So primary prevention will be by vaccine. Secondary prevention will be by doing pap smear and HPV tests and other tests. So it is very important that these tests should be done by all women. Now, another thing, when we are talking about these cancer detection tests, I will also like to talk about something for breast cancer, which is a commonest cancer in women all over the world. Now, there are few tests which can be done for detecting breast cancer at the earliest. And most important, I would say, will be self-breast examination, which should be done by all women. Now, when self-breast examination should be done, it should be done after every period. So immediately in a post-menstrual period when breast is maximally soft. So how to do it? So you should stand in front of mirror in good light, expose yourself till the waist, see if there are any lumps which you can see, or there is sudden increase in size of the breast, or if there is any big vessel which is seen, ulceration on the breast. Then you are supposed to palpate the breast. So when you are palpating, don't palpate it like this. So don't hold the breast tissue like this, because there are glands in the breast which you can feel, and you will feel they all are lumps. So how are you supposed to check it? So you should check it with the flat of the fingers. So check it like this. So check it like this. Now see throughout the breast in all the 4 quadrants, and also check up to armpits. So if there is any lump that you can feel, or if you feel there is some tenderness which was not there beforehand. Now, again, it is important to do it in a period which is after the period, because premenstrually breasts are tender. So you will feel pain everywhere. So if it is still there after the period, it indicates that there can be some problem. So show it to your gynecologist. If there are nipple secretions, then also it is important that you consult the your gynecologist or your family doctor. Now, self-breast examination is important, and then after age of 40, usually we recommend breast ultrasound. And those who have family history of breast cancer should go for mammography every year, annual mammography. And after age of 50, we recommend mammography in everyone. So this is ideal situation, but at least self-breast examination, I think everyone should know. So I talked about it. Now, we were talking about vaccine. So second vaccine, which is again very important, which is not much talked about, but very important, is rubella vaccine. Now, rubella, commonly called as German measles, is responsible for congenital abnormalities in the baby if rubella occurs during pregnancy. Now, what are the symptoms of rubella? Rubella symptoms are like cold, cough, or sometimes rash, which are very easily missed for any flu or any viral infection. So many times rubella is missed, and then the baby may have congenital abnormalities. And therefore, it is recommended that before your pregnancy, you should have rubella vaccination. Now, rubella vaccination usually we recommend from adolescent age group itself. Actually, MMR is given to all the girls at the age of 16, which contains rubella vaccination. But even before usually marriage, we ask you to take rubella vaccination. Once rubella occurs, it is a lifetime immunity. So you don't have to keep on taking vaccinations again and again. So even vaccination taken during that age, which will help to have rubella during pregnancy, which will help to prevent rubella during pregnancy. And so rubella vaccination is another very important vaccination at this age, at adolescent and little older age group. If you, as I said, if you take rubella, you cannot have pregnancy for next 3 months. So better to take it beforehand.
Thank you, ma'am. After you told us all about these vaccines and tests, and of course conditions like cancer, it's now the gravity of the topic is striking in that it's a very important part of your health, and it should be part of your health regime that you get those tests done regularly and everything. When we are talking about vaccines and conditions, we can never neglect about what we faced just few years ago, COVID. So were there, I mean, I heard personally there were lots of interactions between COVID vaccine and menstrual health. So were there any really interactions, or were there any side effect, positive effect? What would you like to share with us about it?
Okay. So COVID infection as well as COVID vaccination had few menstrual irregularities later on. So for a couple of months, or I would say 1 or 2 months, basically after vaccination, or even after infection of COVID infection, few women they did have few problems like irregular periods, or they had heavy periods, or sometimes very scanty periods. So change in menstrual pattern. But there is a big study of BMJ which said that less than 1% will actually had major issue. Major issue is it's not major issue, but it is something like a which should be mentionable issue. And the day of delaying the period was less than 1 day, so not much significant. Basically, the thing is that any infection which is caused can give rise to stress, physical stress, emotional stress, and that can affect the menstrual cycle. So any illnesses, even in change in weather, change physical activity, or any emotional stress can give rise to menstrual irregularity or menstrual change pattern. So similarly, COVID also had one, and even COVID vaccine did cause some problems, but not worth talking about it, or not long-term problems, I would say. Not very specific.
Yeah. Regarding vaccine, should we be prepared for, like, in future, in case of any other such pandemics or, let's say, epidemics? Should we be prepared about it in some kind of precautionary measure with our menstrual health, of course?
Very tricky question, because we really don't know what is going to happen after COVID. We are still really not sure why it happened. And we are still not sure whether there will be any other infection later on. But as I said, any infection, even like flu infection, can give rise to menstrual changes. So just have good lifestyle. So even if anyone gets an infection, you are able to come out of that infective phase easier. So I don't think anything specific needs to be done.
Regarding menstrual health and cycle, contraceptions, birth control play a very important role in that whole diaspora. And pretty much it is a kind of not very talked about topic. So maybe if you could guide us about it, that would be really nice.
I think contraception is something which is really not talked about. And therefore, we do come across many women who are absolutely unaware of contraception, and therefore they have to go through unplanned, maybe sometimes even unwanted pregnancies. If we see the history of contraception was even there in ancient age, like in Egypt, even in Greeks, even in India. There is mention of contraception, and they used to try various contraceptive measures. But in modern world, contraception or family planning services, they started in 19th century. And they've initially started in Britain and I would say US. But I'm very proud to say that in 1921, Raghunath Dhondokarve started first family planning service clinic in Mumbai. He had too much of opposition because of that. But even in 1921, he started that family planning service. And that was the aim was for controlling the population. That is one aim. And second, most important was unplanned, unwanted pregnancies. Number of pregnancies were associated with maternal morbidity and mortality. And to reduce that maternal and morbidity and mortality, these services were started. So the basic aim was have planned and wanted pregnancy, and only when you want it. Now, there are various contraceptive measures which can be used. They are natural methods. There are some artificial methods. So there are temporary methods. There are permanent methods. So we will talk about it. So in natural methods of contraception, we usually say there are three methods. One is abstinence. Second is a safe period method or a time period method. And third is coitus interruptus. So what is abstinence? Abstinence is basically not having sex. The most, I would say, 100% sure method, because that is definitely not going to have pregnancy problems. And second most important thing is it is also helpful to prevent STD or sexually transmitted diseases, but not very practical solution, I would say. So what are the other methods? The other method is safe period method. I'd like to share one slide if you allow me. Is it possible? Yeah, right. Can you see it?
Yes, ma'am, we can see.
Yeah. So in safe period method, this is what is the menstrual cycle is. This is day one of menses when the period starts. Usually we say that regular menstrual cycle is around 28-30 days cycle. And usually ovulation or egg release occurs somewhere around 14th to 16th day of the cycle. So ovulation occurs around 14th to 16th day of the cycle. So 7 days before, that is day 7, and 7 days later, that is day 21. So 7 to 21 is considered as unsafe period. So in a cycle where period starts on day 1, we consider day 7 to day 21 as unsafe period. And not to have intercourse or use some other contraception during this period is what is basically safe period method tells us. Now, the problem with this method is when your cycle is very regular, then only we can go for this method. And second thing is, if your cycle is going to change because of any reason, so that reason can be something like illnesses, it can be stress, it can be even weather changes, it can be any reason. So if your cycle is going to change, ovulation day will change. And if ovulation day changes, then the period which you considered was safe is now suddenly unsafe. And you won't be able to know about it because only after ovulation, when you get your next period, then you can mention the day of ovulation, because this period is constant. This period is of 14 days. So if you get your period on 20th, we say ovulation occurred on 14th day. If your period is after 40 days, we say, okay, your ovulation occurred on 24th day. So if that happens, then we were considering 24th day as a safe day, but it was actually not a safe day. So when you are very sure that you don't want pregnancy, don't go by this method because it is not a very reliable method. Third method that can be used, a natural method, is coitus interruptus. That is, before ejaculation, penis is taken out of the vagina. But it is again not very reliable method because even pre-ejaculatory fluid contains some sperms. So it is not 100% reliable method. So about natural methods, safe period method as well as coitus interruptus, they are not very safe methods as such for when pregnancy is concerned. What are the other methods of contraception? The other methods of contraception can be actually using something that can be temporary or permanent methods. Now, in temporary method, there can be barrier contraception, or there can be intrauterine devices, or it can be hormones. So what is barrier? Barrier is basically going to block the entry of the sperms in the vagina. So commonly used barrier method is condom, which is inserted, which is put on the penis, and after ejaculation occurs, the semen will be collected in the condom and it will not come in vagina. Now, advantage of barrier method or condom, I would say very easy to use. It can be used only at the time of sexual intercourse. Not many side effects because not to be taken or there is no consumption, so no much side effects, except that sometimes there can be latex allergy. But problem with condom is high failure rate. Up to 50 per 1,000 women can get pregnant. That is, if 1,000 women or 1,000 couples are using condom, in a year, there can be up to 50 pregnancies. But this is usually because of irregular use of condom rather than it is because of rupture of condom or leakage of condom. So if you use condom very regularly and 100% times, and after use, if you check condom that it is not broken or it is not ruptured, then it is a good method of contraception. There are female condoms which are available, not commonly available in India, but they are available in Western countries, and they are to be inserted in the vagina. They again act in the similar way, and failure rate is equal or a little more than male condoms. Third is spermicidal jellies or tablets or pessaries are available, which are inserted in the vagina just before the act of intercourse. The action lasts about for 40 minutes, and therefore if there is intercourse within that time, the jelly is going to cause death of the sperm. They will not allow sperms to move around, and therefore it will not allow sperms to go in the vagina. But failure rate for this is even higher than condom. So in barrier contraception, commonly used method is male condoms. The second type of temporary contraception is intrauterine devices, where a device is inserted inside the uterus. I have just got one photo of this because many times when we say that device is inserted inside the uterus, everyone panics. Oh, something is to be put in my uterus. My God, what will happen? So it is a very small device, It's usually a T-shaped device, but there are various types available, and it goes inside the uterine cavity. It usually contains copper, which will cause inflammatory reaction in the uterine wall, and therefore it will not allow pregnancy to occur. Now, there are threads here which come out in the vagina, which will change the pH of the cervix, and again they will block the entry of sperms, and because of which there won't be any pregnancy. Now, problems with COPD or intrauterine device is basically sometimes it can give rise to heavy periods or painful periods or prolonged periods, but most of the times they get settled in first 3-4 months. If they are causing heavy period or painful period, we can give medicines, but if it is not helping, then we have to remove COPD. Now, failure of intrauterine device, failure of contraception, it can be up to 7 per 1,000. So if 1,000 women use it in a year, there can be 7 pregnancies. So it is quite a reliable method. Usually not inserted in most of the countries. It is not inserted before first childbearing because it is also associated with increased risk of infection of the uterus, and therefore it is usually not inserted before first childbearing, but can be used. Then there are hormones. Hormones are most, I would say, in methods, they are quite reliable methods. They can be pills, they can be intrauterine device which has hormone in it. They can be implants, they can be rings. So various things are available with hormones. Pills are medicines which are to be tablets to be taken. Now there are various types of pills, very low dose pills, very low dose pills. So depending upon the constituents of the pill, you will have regularity of the period. But one basic thing is when we reduce the amount of hormone in the pill, regularity of the cycle is lost, but side effects also go down. So if it is very low dose pill, menstrual regularity may not be there in initial period, later on it is there, but the side effects will be minimal. When it is slightly higher dose pill, menstrual regularity will be there, maintained, but side effects can be little on a higher side. Now, usually side effects are of 2 types. First is, we say temporary effects or minor side effects, and then second is major side effects. So minor side effects, there can be little amount of weight gain, there can be sometimes nausea or sometimes skin changes. Major side effects are usually seen in women who are grossly obese, who are hypertensives, who are diabetics, and therefore in them we don't recommend using pills very often. If there is history of jaundice in last 6 months, we usually don't recommend pills because it can have effect on liver metabolism. Sometimes if you are taking pill for years together, there can be post-pill amenorrhea, that is your menstrual cycle may not start immediately. But otherwise pills are quite safe. It is quite safe method if it is used properly. IUD, that is intrauterine device containing progesterone hormone, is another method. It is called as LNG-IUS, and it will prevent pregnancy. Now, the failure rate for any hormonal contraceptive is usually less than 1 in 10,000. So that is, if 10,000 women use it, there will be less than 1 pregnancy, which is quite more for barrier as well as for intrauterine devices. Now, this was regarding hormones, and the permanent method can be tubectomy or vasectomy. So what is tubectomy? Tubectomy is, say, these are fallopian tubes. This is one fallopian tube and this is second fallopian tube. So tubectomy is blocking this tube. So you can cut and tie it, or you can put a band around it so that there won't be any transfer of egg or sperm through the tube, and this will prevent pregnancy. But you have to remember that this is going to be a permanent method. So if you want to revert, there is very less likelihood of reverting this method. Similarly, in men, usually vasectomy is what is recommended. Now, if you ask me permanent method, whether to go for tubectomy in women or vasectomy in men, I would say vasectomy in men. Why? Because it is simpler method. You don't have to enter in the abdominal cavity. But unfortunately, what I would like to say is contraception is considered as responsibility of women in most of the societies. So because women get pregnant, they have to use something, or it is their responsibility, and therefore most of the times men are reluctant to go for any permanent procedures like vasectomy. Usually women, the percentage of vasectomy is really very less in India. most of the women go for tubectomy rather than going for vasectomy. So actually vasectomy is quite a safe procedure, but as I said, because contraception is considered as women's responsibility, they don't go for it. Right. So this was regarding contraception. I will stop sharing the screen. Can you stop the share? Yeah.
Yeah. So you have lots of years of experience. So would you like to share some of it with us, like you glimpses of your years of practicing as a gynecologist? We would like to know some of the experience, like the experiences that you remember the most, or those maybe can teach us some things or like that.
Sorry, I didn't get you.
Okay, so I think you can maybe if you would like to tell us about some of your experiences practicing as a gynecologist, some experiences that can teach us more things, or that we can learn about, or we can learn things from it.
Okay. I can. I've been working in gynecologist for 30 years. And so I can tell you about the change practice then and now that I can tell you. As today's our topic was basically regarding menstruation and adolescent education and all these things. I've been I've been taking education, conducting education programs in various schools and various colleges since last, I would say, 25 years. And there were quite many experiences. The experiences also have changed now. So previously, when I used to go to the school and when we used to say that we want to take sex education in school. Someone is, I think, talking. Can you?
Yeah, I think there is some interruption. Please, if somebody is talking, please mute your mic. Ma'am, please continue.
Yeah. So initial period when I went to, I'll just remember one thing. So once I went to one school and I was going to talk about reproductive health with the girls who were in 9th and 10th standard. When I started talking about it, I came to know that they are absolutely unaware of reproductive system. And I said, how come? Because they have, in biology, you have reproductive system in your syllabus. So human reproductive system is there in the syllabus. And how come you don't know anything about reproductive system? That they were even not aware of reproductive system as such. So that the teacher told me that usually we keep that topic for option. So that was something, because we are very uncomfortable about talking. It was a girls' school. So it was not like co-ed school, but still the teachers were very uncomfortable. You know, another school teachers told me actually that henceforth we have decided that we are going to call you or some other doctor for this topic, because otherwise also we are very uncomfortable talking about it. So because you spoke about it, now we are quite okay with it. Many times it happens that in schools, when we go for adolescent education lectures, how we do about it is basically in earlier years, that is from 5th to 8th standard, we talk about more about menstrual hygiene and menstruation and growing up things like breast development and puberty changes and everything. And in 9th and 10th standard, we usually like to talk a little bit about sexuality. We also like to talk something about contraception, because these are to various things, and then they should know about it, because the days have changed, and therefore now they are more to our suggestions. Now, another very important thing is many times boys are taken to another class, and we take lectures only for girls. So we try to have a co-ed. So we tried to have lecture with boys and girls, but girls were not very comfortable about it. So then we decided, okay, we will have 2 lectures side by side, one for girls and one for boys. And in those lectures, we are going to talk more about their problems, like their gender, but also a little bit about the other gender. So they are aware that what we are talking about and what we are talking about with the other gender, and they are comfortable about it. Now, previously, girls used to be very hesitant about when they were talking about, even in the practice, women used to be very hesitant when they were talking about menstruation. Even now in rural areas, menstrual problems, they are usually ignored problems because they don't have time, they don't have money, they don't think it is important to go and talk about menstrual problems. So they will come only when the situation is really bad. But nowadays, days have changed. At least in urban areas, they are more aware of their problems. They are more aware that they can take support or they can take help of doctor. But still, I would say that doing regular testing is still not much in vogue. So women don't come after delivery is done. They don't come unless they have some menstrual problem. So smears are necessary. You have to visit if you have any menstrual problem. So that is something which is still there, better than previous years, but it is still there. They are more open regarding sexuality. They are more open regarding contraceptive use, at least in urban areas. They know about various contraceptive measures, but unfortunately, many times instead of using contraceptive measures, they think that abortion process is a method of prevention of pregnancy. Or it is a method of contraception. So here I would like to say is contraception is prevention of pregnancy. Abortion is actually aborting the fetus when you are pregnant, and it is not the same, because abortion is associated with quite many complications, quite many problems, quite many side effects, and therefore it should not be considered as a method of contraception. Because many times girls don't use contraceptive measures, but they go for abortions, and which are quite unsafe for their body. So prevention of pregnancy is better. So you should have planned pregnancy. You should have you should have safe sex. That is what is important, better than before, but exposure is more. So I think this message needs to go to everyone's mind. It's abortion is not a method of contraception. Contraception is something like prevention of pregnancy, and please take medical advice and use a proper contraception to prevent unwanted or unplanned pregnancy.
So from your experiences, I got another question. Another question comes into my mind that those people who don't experience this menstrual cycle or periods as such. So what can be the members of society who don't go through this cycle and this phase and this experience of periods, what can their contribution or role can be in the whole scenario of this menstrual cycle and menstrual health?
Okay.
With maybe celebrating or acknowledging a day like Menstrual Health Day be beneficial for this role or contribution? Or are there any other measures that can also be taken?
Okay. I would like to answer two things in your question. One is something like Menstrual Hygiene Day or Menstrual Day, which is nowadays on 28th of May. Why 20th of May? I think everyone knows about it because it is a 28-day cycle and 5 days of bleeding. So 28th of May, it's Menstrual Hygiene Day. I think Menstrual Hygiene Day is important because it is a time, or we have got an opportunity to highlight the importance of menstruation care. So it is important to raise. It is also helpful because we can raise awareness about issues faced by those who don't have any access to sanitary products. So, or those who are not privileged enough to have access to medical facilities or sanitary products or good hygienic practices. So to raise awareness about this is something which can be done on Menstrual Hygiene Day. I myself don't believe in these days, because I think it should be a continuous affair that we have to keep on creating awareness and raising the awareness. But having some such days is useful because then it comes into limelight and there is people know about it, and then something can be done. Because when there is a day, it will be celebrated. So when it is celebrated, people know about it and there will be improved awareness. Menstrual Hygiene Day, I think, was started in, I think, 10 years back by a German NGO called WASH. And the aim was same, like we have to provide services to those who are underprivileged and to raise awareness about menstruation. So this is something which is good because we can have educational lectures, we can have camps where we can talk about it, we can provide things. But whenever we are talking about providing sanitary napkins or providing, because many times what organization do is they only provide sanitary napkins, but how to take care of their disposal is never discussed. Whether how to properly dispose them of, whether providing incinerators is useful. So this is never discussed. So only providing sanitary napkins, I don't think is right. Also talking about their good disposal, proper disposal is something which should be talked about. Second thing I would like to talk about is about role of opposite gender in this menstruation thing. Because whether they should be aware of menstruation, whether they should be, definitely they should be aware of menstruation. They should be aware of problems which are faced by women during menstrual cycles, during premenstrual period, and so on and so forth. So I think parents, like both father and mother, should be more open to discussion with children regarding it. Father and brothers can be more supportive to them. There should be more openness between girl students and male teacher, so that girl student should be able to talk about it, that she is having menstrual problem. So she should be able to talk about it openly. There is no need for any secrecy or something. You don't have to hide about it. But I think that's it, because this is a natural or physiological process. It is not something like a disease. So it's not necessary to make too much of hush-hush about it. Oh, menstruation, oh, it's nothing like that. It's just a natural physiological thing any woman or any girl goes through. If she wants some special treatment, care, then okay, it should be provided. But otherwise, making unnecessary hush-hush about it, I don't think is necessary. What is necessary is to be aware, to be sympathetic towards the needs of the girl. I think one very important thing is providing good washrooms in schools, in colleges, providing sanitary products in schools and colleges, and even in offices where girl can or the woman can go and have clean, hygienic washrooms. Is something that is more important. So that is how the awareness in the society should be there. And I think the attitude of opposite gender should be sympathetic. They should be aware of the problems, but that's it. Because we have to understand that this is a very natural and very physiological process.
I have heard lots of myths surrounding the menstrual health. Let's say you cannot exercise during periods, or let's say you should not take medicines during, before, or after periods that alters your menstrual health. PMS is not a real thing, it's all in mind. So can you please tell us a little bit about it?
Okay, so we do hear about various myths in about menstruation. The commonest myth that we come across is women shed impure blood. So is it really impure blood? So it is not impure blood. So it is basically endometrial lining, that is a uterine lining along with blood, which is shed during periods. Now, why it happens? Because normally in a menstrual cycle, after ovulation, or even before ovulation, endometrium, that is lining of the uterus, it starts developing because it wants to act as a bed for the baby if there is pregnancy. Now, when there is no pregnancy, there is no need for this bed or this lining, so it is shed off during the period. So it is nothing but an endometrial lining and blood. So there is nothing impure about it. Now, many of these social beliefs or social norms are because of they consider that this is impure blood. woman is impure that time, so she cannot go to temples, she cannot touch anything and all these things. But as I said, that there is no scientific thinking behind it, because it is basically, it's just one phase of a menstrual cycle where she is menstruating. Now, regarding exercise, I would say again a wrong thing. We usually suggest that if you do exercise, a mild to moderate exercise during your menstruation, that helps you to relieve cramps during menstruation. So avoid excessive exercise or very heavy workout, but actually you should do mild to moderate exercise. Go for walks. You can do some type of yogas that usually help to reduce your menstrual cramps and menstrual problems. So not doing exercise during menstruation is wrong. Another myth that we commonly come across is whether you should be sitting on one side. Nowadays, it is not commonly seen, but previously it was very common that you should not touch this, you should not do it. So previously, when women were doing physical work, and they used to get some rest in that physical work. But nowadays, we are not doing much of physical work. So I don't think it is necessary to take any rest or not go for job, not go for work if you are absolutely fine during your menstruation. Don't wash your hair during menses. Again, don't compromise your hygiene. It is okay to wash your hair. Actually, having warm baths will help you to reduce the pain. Having hot baths can sometimes increase the blood flow. So that is why it was said that don't wash your hair, don't go for very hot water baths. So hot water baths sometimes can increase your blood flow, but warm water baths usually help to reduce your menstrual pain. Many times girls do come to me with their mothers and they have painful periods, and mother said, oh, I don't give her any medicine to reduce the pain because otherwise she will get a habit of it. So why that girl should suffer? So if you have headache, you take a painkiller tablet. Similarly, if you have a menstrual cramp, you can take a painkiller. There's absolutely no problem regarding it. You can take antispasmodic to reduce pain. You can take a painkiller to reduce pain. It is completely safe. And the only thing is take it under after doctor's advice. That is what is important. One thing that I said was, we have already discussed about premenstrual syndrome, but many times it is said, she's suffering from PMS. Tell her that it is not a problem. It is just her emotional thing. So it is just a psychological thing. It is not actually a problem. So it's not like that. It is a disease, or I would say it is a problem. It is a disorder where there is excessive reaction to hormonal fluctuations. So women do go through premenstrual problems, and we need to have a more sympathetic attitude towards premenstrual problem. So if you have premenstrual problem, don't worry, please visit the doctor. You will get treated, you will be counseled, and because it is not something in mind, it is actually a problem. So these are the common myths. Any other myth, if you know, you can talk about.
Ma'am, I think that brings us almost to an end of the session today. But before going, I see there are just two questions that maybe we can in short discuss about it. Children having Down syndrome show lower bone density and early aging. How is the menstrual cycle affected in these kids? Do you observe early menopause? How to take care after menopause?
Okay. Now, many of the chromosomal abnormalities are associated with little changes in menstrual patterns. So many of the girls do have little irregular periods. Many of the girls do have now Down syndrome or any chromosomal abnormality children, they have more tendency to gain weight. And if they, because maybe they don't get adequate exercise, or maybe they change eating patterns or whatever it is. And so there are more possibilities of irregular periods. There are more possibilities of menstrual disorders. There are no studies which say that they will have early menopause or something. But if any child is having epilepsy along with it, because they are getting convulsions or something, then the medicines which are given they can cause osteoporosis, and therefore bone health in them is very important. So they need to visit the doctor to prevent osteoporosis or to have good bone health.
I think it's good time to conclude our wonderful session today. Thank you so much, Dr. Vaishali Biniwale ma'am, for taking out time out of your busy schedule and having this wonderful semi-chat kind of discussion and session with us. And I hope all the participants enjoyed the session. And thank you so much for thank you for the participants for participating, and thank you, Vaishali ma'am, once again for joining us and guiding us.
Thank you, Devashri. Thank you.